and equity so that we can assess together ways to place a racial and equity lens onto every element of our reopening. When the governor walked through the triggers, for example, for moving into phase 1, it was that effort that helped lead to why one of them includes making sure we have the capacity needed in our communities disproportionately impacted by COVID-19. We also want to continue to work together on how we can incorporate that lens into our reopening. We've already begun thinking about how to make sure businesses within communities hardest hit are able to participate and engage with us in the reopening process. And we'll want the Commission for Health Advocacy and Equity to continue to hold us accountable, knowing how critical it is to make sure that on the other side of this, we have communities in every zip code in Rhode Island who has bounced forward to be stronger, more economically resilient at the end of this pandemic so that we can all be prepared going forward together.
Christian Winthrop from Newport Buzz asked you, Dr. Alexander-Scott, how many travelers entering Rhode Island on the mandatory 14-day quarantine have tested positive for COVID-19?
That's a great question. It's similar to the one that was asked yesterday about how many out-of-state visitors were hospitalized. That's data we are still culling. We haven't forgotten about that question. It requires us to go back through every single hospitalization and now case to help understand that. But my understanding, particularly for those who have traveled and needed to quarantine, that number is relatively low. The quarantining process is a critical one. It allows us to help make sure that someone can monitor at home, not in the public setting, for symptoms to develop, and then we can work towards getting them tested. So the number that we will have, which we'll work towards obtaining, would be among people who were unlikely to transmit the virus to another person because they were following the process appropriately, and that at all times is the key. We want to make sure that someone does not transmit COVID-19 to the next individual by doing the social distancing, wearing the masks, quarantining upon return from travel, and washing your hands regularly.
Governor Doug Lizette has another question about gyms. When will they be able to reopen, and what rules do you expect they'll need to follow?
So gyms, we're targeting for phase 2. It's a little bit more complicated, obviously, with equipment and sanitizing the equipment. As I said, in an ideal world, we think phase 2 will be about 14 days, from phase 1. And what rules will they follow? I don't now know. We're still working on that guidance, but it'll be, much as you would expect. More social distancing, limited capacity, perhaps limits on the number of people who could be in the gym at any one time, extreme cleaning protocols, etc.
John DePietro asks, can churches open Sunday for Mass on Mother's Day? Why not let churches conduct Mass outside or by using spacing in the pews? Why don't you consider church an essential business? And lastly, faith is not a social gathering.
Yeah, so it's a good question. Like I said, we've been talking an awful lot to all faith leaders. I've decided to go for now with the five people. So you could have 5 people in a church or synagogue and broadcast that. You can certainly do, lots of folks are doing the drive-through services, and something more will come soon. But everything I know says take it slow. It is so much better to go slow and gear up than to go too fast and pull back. So if that means waiting another couple of weeks, as hard as that is, I have decided, in consultation with many leaders in faith communities, that that's probably the right way to go.
As Dr. Alexander-Scott mentioned earlier, and this is Tim White's comment, 2 residents at the Veterans Home who have tested positive for COVID-19 have died. Staff members have told us there is a shortage of workers and PPE there. What is your understanding of resources at the home right now?
Yeah, It's definitely a place where we are focused in terms of making sure that the adequate PPE is there and that we're responding to the staffing needs. Sometimes it can happen quickly and the message can come through that someone isn't available to come in for their shift, but then work is done in collaboration and they're able to address that. So that's something that we're in constant communication with the Vets Home about, as well as the other nursing facilities, to help support them in coming up with the solutions for stable staffing. And I really credit our team that the governor referenced earlier in helping to make sure that we have personal protective equipment as a state. Our priority is the healthcare workers in hospitals as well as in our congregate care setting nursing homes. So they know, and we are very quick to respond whenever additional PPE is needed, that we get it to them. So that's been our focus.